Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022. Population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, decision-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. Online evaluation form will be and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to to ask your protection against the COVID-19 virus that has claimed lives and has affected many. We pray for your grace for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is HPV Gone Viral, Achieving Quiescence in Adolescence. HPV Gone Viral, ang pag-iingat sa murang edad. Today's forum aims to give us insights on the details of HPV infection and disease among adolescent population. For today's forum, we have Dr. Maria Rowena del Rosario Raymundo, the Vice Chancellor for Academic Affairs, OIC, and Associate Professor of UP Open University, Subspecialist in Infectious Disease and Consultant of San Pablo College's Medical Center, as our moderator.
Hello, everyone. Thank you for joining us today in the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, the Mu Sigma Phi Foundation, UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum discusses some common concerns of women from all ages and all walks of life. We are on the 8th leg of our year-round webinar series. Can you believe that? A month ago, we started our HPV infection series, wherein we tackled a lot of concerns that women face. Well, today we're continuing on with the series with another enlightening and informative session. If you have any questions for our speakers later, you may type them into the Q&A boxes of UPM Livestream and Zoom, or the chat boxes of FB Live and YouTube. Our 8th webinar, entitled HPV Gone Viral, Achieving Quiescence in Adolescence, aims to introduce us to HPV infection and disease among adolescents. We're going to learn about the burden of disease, risk factors, manifestations, diagnostic options, and treatment and prevention. To formally start the webinar, I am honored to introduce our esteemed speakers, who are both alumni of the UP College of Medicine and distinguished members in the field of infectious diseases in obstetrics and gynecology, Dr. Jean Santos Abalos and Dr. Sybil Bravo. Our first speaker is Dr. Sybil Lizanne Bravo. Dr. Bravo is an acclaimed alumna of UP College of Medicine Class 1996. She is currently the president of the Philippine Infectious Disease Society for Obstetrics and Gynecology, or PIDSOG, and the vice president of the Asia Oceania Research Organization on Genital Infections and Neoplasia, or AOGIN. Apart from this, Dr. Bravo is also active in the academe, as she's one of the clinical associate professors at the UP College of Medicine. Please join me in welcoming Dr. Sybil Lizanne Bravo of the Mu Sigma Phi Sorority, Batch 1997.
Thank you very much, Sis Weng, and of course, everyone for inviting me to this very prestigious event. So I'd like to share my screen. As was mentioned, our lecture will be about HPV in adolescence. So it's gone viral. So how to achieve quiescence in this age group. This will be our learning objectives. We'll discuss the burden of disease among teens, to review the risk factors, to learn the manifestations of HPV among adolescents, and to know how to diagnose and treat this infection. So we know that estimates have it for last year that about more than 600,000 new cases of cervical cancer are occurring each year. And I'm telling you about this because we know that cervical cancer is one of the gravest complications of the human papillomaviral infection. So cervical cancer, all in all, is a fourth leading cause of female cancer, and it is second most common cancer among females aged 15 to 44. Now, these are the time trends in cervical cancer incidence globally. We see that worldwide, there are indeed few cases, okay, of cervical cancer among very young girls aged 15 to 24. So this is the yellow dotted line. And the trend shows increasing rates with time through, though the rates are definitely higher for older women. And the trends are much higher in low and middle income countries where we belong as compared to high income countries. But of course, we know that they have much improved cervical cancer screening and anti-HPV vaccination programs. So we see here that in high income countries, the trends are decreasing for both age groups, while in our region, so take note the lower and middle income countries, the trend might be increasing with time, including among young girls. And Asia is second to African region. So Africa is this orange dotted line, while Asia is the green line, no? The green dotted line. In terms of age-specific mortality, including very young women afflicted with cervical cancer. So several studies have reported that very early sexual debut, so that's the age of first intercourse, is a risk factor for HPV acquisition. And of course, the reason for this is prolonged exposure and persistence of the viral HPV DNA in cervical tissues or other genital tissues that would increase the risk for neoplastic transformation. So our country is very, very small on the global map, but we see here that the percentage of girls who report very early sexual contact is quite high. That's about less than 15 in 100,000 girls, no, in that age group. Now, for oropharyngeal cancers, which is also a quite common complication of HPV disease, the rates per 100,000 women, okay, so in Southeast Asia, also show that women are afflicted with this disease, including very young girls here in our region. So Philippines is included in this area. Here is a study done last 2018 that shows that cost of therapy for HPV-related illnesses is really a big burden among families, no, afflicted with this infection. So one session of treatment, so the x-axis are the types of the specialty, no, doctors who see these patients, and the y-axis represents the cost in terms of Philippine pesos. It would be anywhere from 1,000 to 8,000 pesos, so it depends on the type of the doctor seeing the patient. And of course, in a low to middle income country like ours again, this is too much for most families. So, saan ba tayo mga OB? Itong OB, ano? So the cost would be around 2,000 to 8,000 per session, okay, for female patients. Added to the cost of therapy, as was shown in the same study, as a burden is the grave psychological aspects or the psychosocial issues afflicting our patients, such as depression, social isolation, and fear of having cancers in the future. Added to that, with my experience, and I'm sure you will also agree with me, some of our patients really have suicidal thoughts, especially those who suffer from recurrent genital warts. Now shifting gears, let's now talk briefly about the natural history of HPV among young people. Is there really a difference in the biological effects of this virus compared to adults? Now, anogenital infections are extremely common in the sexually active adolescents. So if they are sexually active at very young ages, with over 50% of them having a positive HPV DNA test over a 3-year period. So let's say if they had their first sexual contact at age 14, when they become at age 17, no? So they turn to be 16, 17, or they reach their debut for females, more than half of them now will have acquired HPV infection. Several studies have shown that a recent new partner is a very strong risk factor for acquiring infection. So other risk factors are, of course, having STI, which may result or reflect rather the inflammation resulting in the break in the mucosal barrier. But again, for some good news, it's not always bad news. More than half of these infections are really transient because, no, bata ang mga, immune system, no? They are very immune naive. Most of these infections can be cleared within 6 months of acquiring the infection, or with 90% can be cleared within 2 to 3 years. But of course, it depends on continuous exposure and on the intactness of the immune system. So more than 90% of low-grade squamous epithelial lesions diagnosed in adolescents or young women would also resolve spontaneously. Now, what is HS, high-grade squamous epithelial lesion, is far less common than LCL, but adolescents and young women have a prevalence equivalent to older women with rates of around less than 1%, around 0.7%. Again, the greatest single risk factor for developing this condition is HPV persistence. However, in one study, a portion of adolescents develop HCL shortly after HPV acquisition, suggesting that some women develop high-grade lesions without very long persistence. So again, take note of that. So other risk factors are smoking, and we know that some adolescents really do use cigars, they smoke, or prolonged oral contraceptive pill use, so that's more than 5 to 10 years of steroid use. Now, many studies, including a recent collaborative study involving more than 50,000 women, have shown again that age of first intercourse is a very important risk factor for future development of cervical cancer. Now, why is it that, young women can be, again, at risk of having genital neoplasia or neoplastic changes? Is due to the vulnerability, which is due in part to the immune, or rather naive immune response, since the rate of HPV declines with age, even when controlling for sexual activity. Again, the clearance of infection appears to protect women from repeat infections with that of genotype. Studies have shown that increase in the risk of developing cervical cancer is highest when women have their first intercourse before the age of 24. Now, biologically, adolescence reflects a period of dramatic changes in an area of the cervix, which is known as the transformation zone, where squamous cell cancers can develop. Now, the cervix in the adolescent individual is primarily made up of columnar and metaplastic cells, whereas adults are predominantly, they have squamous epithelium. Now, this type of epithelium is vulnerable to wounds induced by repeated intercourse. Well, it doesn't have to be necessarily penetrative, no, penetrative intercourse. So even skin-to-skin contact or rubbing of skin to skin, no, could cause microabrasions, and then it would be a good venue for entry of the HPV DNA. Douching, use of tampons, again, can lead to breaches in the epithelium, and again, easy access or entry of HPV. So a very recent study by Castle et al. Uh, with HPV types, no, ito yung mga more oncogenic types, 16, 31, 33, 35, 52, 58, and 67, were more common among women with large areas of cervical ectopy, but not common in women with mature cervix. So we know that adolescent women are the ones who have large areas of ectopy in their cervix. Now, more important than the presence of columnar epithelium is the likely presence again of the active metaplastic epithelium. So, a recent study again showed that both oral contraceptive pill use and cigarette smoking can enhance metaplasia among young women. Now, moving on, let us now have a quick review about the manifestations of HPV in teens. Well, in general, HPV would clinically manifest in the same way as do in adults. They could also have genital warts. Okay, so for those of you who are having your lunch now, patawad po. Although we say that most infections again can be asymptomatic because they are with immune clearance, but again they are not immune from having, or they're not exempted from having low grade or even high grade genital lesions. And again, some of the precancerous lesions, so mind you, may progress to cervical cancer, but though it's very, very small percentage. So they can have also anal neoplastic changes. Again, genital warts, commonly known as the condyloma caminata. And again, our young women or even males, no, mga teens, can also have oropharyngeal lesions or cancers. For males, they can have penile intraepithelial neoplastic changes. For toddlers, no, they can suffer from respiratory papillomatosis, especially those born to young women who have genital warts and they were born vaginally. And also, our women can suffer from vaginal or vulvar intraepithelial neoplasia. So these are taken from teens. So this is anal warts, okay, cervical warts, and vulvar warts, no, along the labia. So more photos. This is an example of a penile wart. So this is along the shaft. Anal wart again, and along the vulva. Now, how do we diagnose HPV? Well, it's easy to diagnose, especially when you're at it, when it really is, you have been, seeing these types of patients. We only need, of course, experience and a bit of expertise to definitely say and commit that this is definitely genital warts. Well, most of the time, we need only visual inspection with our eyes, so this is our clinical eye. Biopsy is not indicated, except, of course, when there are atypical lesions, or you cannot rule out, of course, neoplastic changes, so more proliferative, the lesion easily bleeds to touch, or of course, when you cannot rule out condyloma lata, that's the secondary skin manifestation of syphilis, then of course you have to do biopsy. And among immunocompromised individuals, including immunocompromised teens, both males and females who have HIV or uncontrolled diabetes or other chronic renal problems, then you definitely have to do biopsy. How about HPV DNA typing? It is not recommended because studies have shown that knowing the particular type does not really change your form of management. You have still to offer the same form of management as you do with low-risk types of HPV. Now, how about cervical cancer screening? Well, the WHO does not recommend to start screening at earlier ages because studies have shown that, again, as I have mentioned earlier, HPV infections among young individuals are very, very transient, and as such, the WHO recommends screening only starting at 30 years of age and beyond, except, of course, when these women, they're younger and they have risk factors. like when they have, again, immunocompromising conditions, HIV or any other chronic diseases, then you have to screen them at earlier ages and every 3 to 5 years thereafter, or earlier as needed. So how do we treat HPV among our adolescents? Again, there are no differences in treating HPV in the teen and in the adult. So we have, again, the provider applied and the patient applied modalities of treatment. The choice would really depend, of course, on the availability of the technology or the medicine, patient preference, and of course, provider experience and cost of therapy. No, nakalimutan ko lang pong i-add siya. It's really cost of therapy that is most of the time a very big factor. Now, these are the patient-applied forms of treatment. Well, of all these, it is only imiquimod 5% cream that is locally available, and it is safe for use among our teens. So the youngest age that we can prescribe this cream is children age 12 and above. For the provider applied or techniques, these are your cryotherapy, electric cautery, of course, surgery, carbon dioxide laser, or application of or bichloroacetic acid. And these are all safe for use among our teenagers. So now we know that HPV is the most common sexually transmitted infection among adolescents, and it manifests clinically in the same way as they do in adults. Diagnosis remains the same for both young people and adults, and modes of therapy are also the same as we do our older patients. What is more important, of course, are prevention and education that we give our young generation. And this will be further discussed by our esteemed colleague and CIS professor, who is our next lecturer. With that, I'd like to thank you for listening. See you later.
Thank you so much for that very informative talk, Dr. Sybil. We learned so much. It was also both cautionary and yet reassuring, especially when you mentioned that many of these infections are actually transient and that it is persistence that causes most of the problems. So we've seen that the burden of disease of HPV is great in all women, but especially so in adolescents. And to further enlighten us on this topic, let us now welcome our second speaker, Dr. Maria Virginia M. Santos Abalos. Dr. Abalos is a distinguished alumna of the UP College of Medicine class 1981. Currently, she is the medical director of Chonghua Hospital in Mandaue City. And along with this, she's also the regional director of the Philippine Society for Climacteric Medicine. Dr. Abalos is also one of the board members of the Philippine Obstetrical and Gynecological Society. Apart from these administrative roles, she's also currently a professor in Cebu Institute of Medicine. Ladies and gentlemen, I am proud to introduce my idol sis, Dr. Maria Virginia M. Santos Abalos of Mu Sigma Phi Sorority, batch 1981. Dr. Jean?
Thank you so much, Wen. No? Then let me share my screen. So, am I good? Can you see my screen?
Very nice screen po, Dr. Jean.
Okay. So thank you, Wen. Thank you, Sis Jean and Lilibeth, for this opportunity. And of course, thank you so much to Sybil for being first, because a lot of things have already been explained by her. No, the very straightforward discussion. Indeed, we have been made aware of the strong relationship between HPV and cancers. So we want to look at achieving quiescence in the adolescence, a stage when we can have a great impact on HPV control. So now let me discuss the issue of prevention. Okay, so the first question is, why focus on adolescents? We know that HPV is commonly acquired shortly after sexual debut, peak incidence ages of 15 to 25 years. So this is a very important age where we can catch them. And take a look, most oncogenic HPV infections are acquired between the ages of 18 to 26. These very high rates, as mentioned earlier by Sybil reflects sexual behavior and biologic vulnerability. Adolescent psychosocial development includes a strong desire for autonomy and an increase in risk-taking behaviors, including high-risk sexual behaviors, no? Especially since adolescents are not yet in stable, committed relationships, so they flit from one partner to another. They're also biologically vulnerable as adolescents, as mentioned, have the highest rate of metaplasia. And we know that these metaplastic cells within the transformation zone, the newest and the least mature cells, making them the most vulnerable to oncogenic change. Therefore, the two most effective strategies for cervical cancer prevention: primary prevention, vaccination of the adolescents, and secondary prevention is screening during adulthood. Still, we need to emphasize behavioral changes, especially in a community like the Philippines. No, this should be part of our preventive strategies. And to achieve this, parents and us, healthcare professionals, we are the key to protecting adolescents from HPV cancer. So first, let's look how can we promote responsible teen behaviors. Young people should understand their bodies and how it functions. They should know the risk and consequences of sexual behavior so they are able to set boundaries and reduce this risk. That way, they are able, hopefully, to act responsibly according to their personal values, and very important, to access healthcare services and information. The latest that I can share with you will be the YAF study of 2013. Now, for the information of the younger ones who are not familiar with YAFs, YAFs is the Young Adult Fertility and Sexuality Study. They're doing the largest series of national and regional cross-sectional surveys from age 15 to 24. So 2013 was the last, but good news, last September, YAFs 5 was already approved, and we hope to get the results in late 2021. So I'd like to share with you the results of 2013, but please do understand that the current situation may have changed already. Age of sexual initiation. Remember that sexual initiation starts the exposure to the risk of STIs, including your HPV. Age of sexual debut in the Philippines has decreased. 17.8 years for males, 18 for females. No, but look at the trend. From 1994 to 2013, we have an increasing proportion of our youth having started sex younger than age 18, roughly 1 out of 5. No? And of course, if we take a look from 15 to 24, 1 out of 3 Pinoy youth has engaged in premarital sex, with the highest levels at the NCR and Central Luzon, roughly at 40%. Again, we look at trends. Do you have increasing trend to engage in premarital sex through the years from 1994? And take a look, there's also a narrowing gap between males and females. Our females today are already starting to behave also like the males. And if we are brave enough to extrapolate this data to today, the figures may even be higher considering this upward trend. And hold your breath, Pinoy youth have engaged in risky sexual activities, casual sex, fuck buddies, men having sex with men, and extramarital sex. And take note, a lot of these risky activities are unprotected against the risk of STIs, no condom use. And what is this telling us? There is indeed a great need to re-emphasize responsible behaviors. And this is a research done in Andalusia, which showed that healthy adolescent sexual behavior is aided by communication within the family. But again, to be able to be reliable sources for the youth, families need more scientific information about HPV and vaccination, and that is where we come in. Therefore, health professionals, we are a key element in this process. We need to spend time to discuss these risky behaviors with our teens, with the parents, and explain the pathogenesis of cervical cancer from HPV. Next, vaccination, and this is probably our strongest defense today. The basic tenet of HPV vaccination: prioritize immunization even before you initiate sexual activity, because that is when HPV exposure is a reality. This is Philippine statistics. HPV causes not only cervical cancer, but a host of other head and neck cancers. So if you look at the data, we have more than 12,000 people getting cancer caused by HPV. That's 33 persons every day, all year long, 1.4 persons every hour getting cancer caused by HPV. And how are we doing so far? No, as far as vaccination is concerned. No. This is a 2021 report which showed that HPV vaccination remains low in the Philippines. 23% first dose, 5% second dose. And in the US, it's the same. It's also below their national goals, but definitely better than ours, no? 68% initiation, 51% completion. In the US, it is positioned as part of the adolescent platform together with your Tdap and your meningococcus, which posted much higher vaccination rate, 89, 87. But the irony is, the burden of HPV-related mortality is much higher, even if you combine the mortality from your T, D, pertussis, and meningococcus. No? So that's the big irony. It is therefore not a surprise that these highly respected bodies, including our very own POGs, are one in promoting routine HPV vaccination from 9 to 14 ideally. And what more, the advantage of this age group? 2 doses will suffice because of the very strong immunogenic response in the younger age groups, no? And good news, there is no sign of protection waning over time. The message, therefore, is it is not too early to start vaccination. In fact, because of that immune response, young is better. Benefits are also seen in the logistics and the practical side. There is high parental acceptance of earlier HPV vaccination, especially because there is less discussion about sexual behavior. There is more flexibility, more opportunities, leading to a higher completion rate. On the practical side, vaccinating this age group is way below the age of sexual debut in the Philippines, which is 17 to 18 years of age. Okay, granted that this is not the reality today, I think that the age 9 to 14 will still be a good place to start. Therefore, the ASIP and the World Health Organization, very strong recommendation, 9 to 14, boys and girls. Take note, boys and girls, no, not only girls, 2 doses. So what about catch-up vaccinations for older adolescents and young adults? Yes, they can still benefit from vaccination, but the vaccine effectiveness is lower. That's why we need to really target the young adolescents. Still, if we're not able to catch them at that time, majority of the older adolescents and young adults will still derive partial benefit from vaccination. And a very interesting question, vaccination in boys. No? Research shows increasing rates of HPV-related anal and oropharyngeal cancer. In the US, HPV now beats tobacco use as the primary cause of oropharyngeal cancers, and more than 9,000 cases of HPV-related cancers occur in men annually. And following the principles of gender equity, Vaccinating both genders distributes the responsibility to both genders equally. Bakit naman females lang, no? Vaccinating boys allows them to build up their own immunity to HPV infection regardless of the vaccination coverage of girls. And in addition, it must be considered that MSM, a population with a markedly increased risk of HPV infection, do not benefit or benefit only slightly from the herd immunity of vaccinating girls. Therefore, vaccinating boys allows MSM to develop immunity to HPV before becoming sexually active. So we ask ourselves, what is the real world impact of HPV vaccination? HPV vaccination impact study group: reductions in infections, warts, CIN2+. And look at the figures, they're very good numbers. HPV vaccine impact monitoring project: the rates of CIN2+ declined, especially in women aged 18 to 24 years of age, no? And this slide dramatizes the great benefit in the adolescent and young adult compared to your older adults. So yes, we can achieve quiescence in adolescence through responsible teen behaviors and adolescent vaccination. Hopefully, we can look forward to an HPV-related cancer-free world. Thank you so much for your attention.
Oh, thank you so much. That was a very insightful and very engaging talk, as always, Dr. Jean. Thank you for underscoring the importance of both responsible teen behavior and vaccination in HPV prevention in adolescents, among other important takeaways. Now, I know that everyone is really eager to ask their questions, but first, let's hear from our reactor. To share her insights on today's talks, we have with us Ms. Nina C. Licad. Ms. Nina is an experienced marketing campaign manager who is experienced in working in cross-sector industries across the US, Europe, the Asia Pacific region, and Southeast Asia for Ernst & Young Global. Sharing her expertise in marketing and project management, she's always worked on several of the most noted marketing campaigns and both local and global event conferences amidst these unprecedented times. Ms. Nina, an esteemed marketing professional, is a proud alumna of the Polytechnic University of the Philippines. During her personal time, she bakes and sells cookies through her very own mailchimp.com. Moreover, she also writes for her personal blog, manilastreets.com, and contributes for Asian Parent Philippines. Without further ado, let's welcome Ms. Nina C. Licad.
Thank you so much, Dr. Wen, for that introduction. And I also want to say thank you so much for inviting me on this forum this afternoon. So I just want to say that technology has truly paved the way to really keep us connected at this time. And not to mention, despite the distance, because I understand that Doktora Abalos is currently in Cebu right now. So we really appreciate having everyone over for this discussion. And I would also like to congratulate the Mu Sigma sorority for helping us organize this, and a huge thanks to Dr. Lilibet and Dr. Jean as well. So yes, just on this really interesting topic, the wordplay on HPV is and going viral is outstanding. I mean, it's interesting to see how a lot of things get to go viral these days, especially when it comes to social media. But as a woman, and I think on a personal level, conversations like these should be out there in the open. I am aware that back in the day we used to have these kinds of conversations, but not on this level. and not especially not online. So this is really a very good opportunity for all of the attendees right now to really know about the HPV, about how it impacts us and how it may impact our friends or whoever we know who may be facing this challenge. So I do have a couple of takeaways from both Doktora Abalos and Doktora Bravo's presentations. So what I feel is that because young adults are the more susceptible people who can get this. The earlier that we take our time to learn about HPV, the better that we can take care of ourselves, especially for those who tend to get sexually active, whether you are currently at a young age or even with adults, whether you are male or female. So we are talking about a general issue, and it's never too late to be informed. Another thing to highlight is the idea that we need to re-emphasize these kinds of um, topics. We need to have and be responsible for our behaviors, and especially within the family. For parents, I think this is a really good thing to kickstart, to have a conversation with your kids or with young adults that you are living within your household. So there are a few things that Doktora Abalos mentioned as well. So public awareness is very important. You need to make sure that if you have you feel that you're having issues with yourself physically, you can have a visual exam. There are testings that you can do, or simply avoiding the risk factors is just a few small things that give you a bigger chance of not getting it in the near future. And lastly, I think when it comes to really talking about HPV and how you feel, if I've heard earlier today that having this can also give you issues in terms of depression, the emotions that are running. We cannot feel that, is it something that we can talk about with other people? And I think the answer is yes. And I believe the answer is yes. You need to trust your parents, or your guardians, for example, as most especially your healthcare professionals, because they know so much that they can teach you really how to take care of yourself, to make sure that you're managing it the best way possible. I've heard that from a young age you can get it cleared in a matter of months, but there's no promises there. So it's really best to know what you have right now, and to talk to these people who can really give you the best information out there. So again, thank you so much for inviting me, and congratulations again to everyone on this discussion.
Well, thank you, Miss Nines. That was a very astute and thought-provoking reflection and sharing. It's really nice to have our reactors here, because they share with us insights that we never really usually think about as healthcare providers. And I'm also glad that you underscored early awareness and public awareness as being very important, and also the value of having these conversations, not just with friends and health providers, but also with your family. I think that's very important. So thank you to our speakers. Thank you, Ms. Nines. Well, today's talk is the third in the series of the HPV series that the whole Women's Health Forum will be conducting. And over the past weeks, because this is the third, we have learned about HPV infection among adult patients as a public health concern. But the focus today is on adolescents. It gave us a different perspective And I'm sure that many of you have questions in mind that our speakers are more than willing to clarify and answer. So I believe that everyone is eager to start asking their questions. Let's start with the Q&A. Again, you may type your questions in the Q&A boxes of UPM live stream and Zoom, or the chat boxes of FB Live and YouTube. Now, I have some questions here, and I'd like to start with, I have a question for Dr. Sybil. Sybil, kanina you mentioned in your talk na smoking, di ba smoking is a risk factor for HPV infection. And there's a question here, what makes it a risk factor for HPV? And I'm sure marami sa adolescents natin are experimenting, di ba, with, smoking. What makes it a risk factor? Alam ko yung cancer, pero bakit HPV?
Yes, so actually, there was a study that showed that about more than 30% of teens would really experiment with smoking. So that's a very big factor. Well, smoking, not just nicotine, but all the polyhydrocarbons that it contains can influence the incidence and persistence of HPV, that's the virus, the viral DNA, by, suppressing generally the local immune response. There could be increase in cellular proliferation, including that of the HPV DNA, and upregulation of other pro-inflammatory cytokines or factors that could cause, again, DNA damage along the cervical tissue. So these are all the plausible explanations why smoking itself can be a risk factor for increase in activity and reactivation of HPV that could now lead to neoplastic changes.
Wow, nakakatakot pala, Doktora Sybil. Di ba, one thing I would like others to look into is, di ba uso ngayon vaping? The kids are already going into vaping. So I don't know, maybe we need more studies on that. Oo, vape, di ba? So I have a question here for Dr. Jean. Now, in case we want our children to get vaccinated, who do we approach or ask for this? I think, ma'am, yung iba nagtatanong for the younger kids, and paano kung meron silang teens na borderline, yung late teens, pero still pediatric, paano yun? Who do you approach for HPV vaccination? Dr. Abalos.
Yes, thank you for the question, Weng. Well, technically, when you say pediatrics, it's 0 to 18. But being gynecologists, we are able to take care of them depending on the needs of the pediatric population. And vaccination is primary care. So meaning to say, anyone can go to a primary physician, and technically, the pediatric age group will go to the pediatrician, and then the adolescent is somehow what they call the parang confused age, no? Because this is the age where they don't really go to the pediatrician anymore, but neither do they really consult us. But this population, they may still go to their pediatrician or consult us, no? And I would like to extend this to even the family physicians. I think the only requirement that we need is that we know how to give the vaccine, no? The requirements for the vaccine. Why am I saying that? Because I know a lot of pediatricians, when it comes to HPV, yung iba sa kanila magre-refer. I don't know I don't know if you can say they're uncomfortable about HPV vaccination because they're giving a lot of HPV of vaccines, but sometimes they refer for HPV. But I do know a lot of pediatricians also who have integrated already HPV vaccination into their adolescent platform. So I think the short answer to that is any physician, primary physician, and any of the specialists can be primary physicians who are aware as to how to give vaccines, aware about HPV, can give the vaccine.
Thank you, Dr. Jean. I think that's very important for our audience to know, because some of them feel na, naku, kung walang pedia, or if they're kids, hindi na lang siguro magpapa-vaccinate. Or on the other extreme naman, some people think that they need to go to an OB gynecologist for that. No? So thank you for clarifying that. and so that the audience can know that as long as you have healthcare providers who are capable of giving the vaccine. Now, I'd like to call kanina si Miss Nines said she had a couple of questions. Nines, would you like to ask your questions now? Now is the
Yes.
time to ask those questions.
Yes, and just on the topic of vaccine, just going back to Doktora Abalos, with regards to vaccines that are available, what are the options out there? I mean, I know that vaccination is important, but is there a difference when you have HPV, or like if you don't have HPV, or does it differ when it comes to the age will be administered with the vaccine?
Yeah, that's a very good question, and it's a little complicated because we're looking at the different vaccines available. At the present time, we have 3 vaccines available, and all of them are already proven by research to be very effective for the prevention and the efficacy has been shown. The absence of serious adverse effects have been shown, and the immunogenicity have already been shown for all the 3. So technically speaking, we leave it really up to the physician to choose, no, because there are pros and cons as far as all these 3 vaccines are concerned. But maybe I can say that in terms of coverage, the one that will give us the widest coverage will be that of the nanovalent vaccine, because of the simple explanation of numbers, because you are going to be protected against 9 types of HPV. No, so this one will give you more than 90% protection against your cervical cancer, more than 90% protection against your genital warts. No, the problem, of course, with giving you the nanovalent will be cost. Therefore, so I said there are no direct rules about what to give and what age group to give. In our case, we discuss it with the patients to see which one we can best give them. A perfect example I can tell you, even if I am promoting, for example, a nanovalent vaccine, and the mother will tell me, Doc, we cannot afford that, no? So I don't mind giving the quadrivalent or giving, for example, your bivalent, for as long as they know what they are getting into. Because I'm telling you, there are a lot of researches, even for the bivalent, even for the quadrivalent, that gives us very good efficacy, even 7 and 10 years. Now, we have the Costa Rica vaccine trial, we have the Escudo trial. So these are all very good studies showing efficacy. My answer is a little complicated because maybe the situation is complicated, but I hope I answered you, Nina.
Yes, absolutely, Doktora. So thank you for that. And I do have a question for Doktora Bravo as well. So, in terms of topical treatments, is there a proper way of application when it comes to using it, or is there like or cadence, or how long or how often do you need to do that?
There are 2 forms of topical treatment when we're talking of HPV management. The first is the patient applied. So that's the imiquimod. It's actually an immune modulator, a molecule that would decrease the HPV viral DNA load along the tissues affected. So the way to apply it is it's actually available as a cream, 5% cream. We usually advise our patients, so even adolescents, to apply it 3 times a week, usually at night, very, very thinly, sparingly to the area, for a maximum duration of, 16 weeks or 4 months. There's no need actually to wash it off, but if they get irritated, they can wash it off after 6 to 8 hours upon waking up. So, but if their lesions would subside or would resolve after before 4 months, in less than, let's say, 1 month, they only need to apply it for 4 weeks, then there's no need to use it. The second topical treatment is, of course, a provider administered. It has to be given by the doctor, applied by the doctor, because this is acid. It's very, very costly. It's a trichloroacetic acid. We usually apply it once weekly, so once a week, for until the lesions would regress or resolve. Well, maximum 6 to 8 sessions or 1 to 2 months of treatment. After which, if there is no resolution of or the lesions would actually worsen, then of course you have to rule out other growths, you have to do biopsy or to shift to another form of treatment.
No, I know that I've been asking, more technical questions, but it's nice to know that for attendees who are on this discussion right now, they know the options out there. It also depends on the severity of the issue, and you really need to talk to your doctor about it. So there's no guesses that needs to be
Right.
made. You don't have
True.
to guess or to search online just to look for a treatment because it might not be for you.
Alam mo, Nina, I really like what you said kanina in your reaction na the conversations. And this is one instance, right? Na you can have these conversations with your doctor and your, even kasi tama ka eh. These conversations need to happen and we need to talk about it. Kasi for the longest time, this has been hidden or taboo conversation. Now is the time to be aware of it, right? So thank you for that. Thank you, Nina and Sybil. I have another question from the audience for Dr. Jean again. Doktora, are there any data on the outcome of teens given the first dose of the HPV vaccine who were on their first trimester of pregnancy, but they did not know it at the time?
Oh, yes, there are. During the initial phase of the researches for the two initial vaccines, the subjects were supposed not to get pregnant, but of course, sometimes you cannot control that, and some of them did get pregnant. And so both companies, they followed up these people who got pregnant during the study, and lo and behold, they did not see anything in the offspring just because they were given the vaccine during the first trimester. And that is basically the reason why today we do not really do a pregnancy test before we give the vaccine. And if ever the patient got it and the patient turned out to be pregnant, no need to do anything except that we will give the second and the third doses already after the pregnancy. So the most important thing, because we do not have a research really on pregnant patients, we cannot say that based on these observations that we can give. Therefore, number one, we still do not give your HPV during pregnancy. Okay, I hope that's clear. But number two, if ever inadvertently it was given, there is no need to panic. Just don't give the next doses until postpartum.
Thank you, Dr. Jean. I hope the audience got that. No, I hope you remember that. Now, I have another question from the audience, and this is for any of our speakers. The question is, if you already have been vaccinated with Gardasil 4, 3 doses, is it okay to have another vaccine like Gardasil 9 because it covers more types of HPV? Who would like to answer that po? Para yatang siguro naisip, para yatang kulang, nanalugi yata ako, 4 lang yung nakuha ko. I need to get the 9. But I already completed the doses. What do I do po? Can I get? What would you advise?
When I can get that question, I actually presented that during the AUGene. Si Susan Garland actually did a research, no? So one group, they gave the nanovalent to those who already received the quadri, and one group they gave the nanovalent to virgin cases. And what they noted was both groups will have very high titers for the 5 additional, but the one who received the quadrivalent have lower titers compared to those who are virgins, no? when I say virgin, of course, baka malito yung audience, those who have not received the quadrivalent before. So they're saying, so the conclusion of that study was, they cannot make any conclusions if there is any clinical significance with this data. Meaning to say, you may if you wish to, but we don't really know if it's significant. So that's the conclusion of that study.
Wow, thank you. I'm actually sure that a lot of doctors get that question. Na
Yes.
pwede bang umulit or pwede bang magkuha ng another brand? What about po naman if the patient did not complete the vaccine series? For example, she only got 2 out of the 3, or hindi niya na-complete yung dose. And then now she wants either to parang resume, or do you advise that she start from the first dose again, or can she just take the 3rd dose anytime?
Ma'am, in my practice and experience, and as we see in other studies, well, of course, it's ideal to stick to the original regimen, kung 014 or 026 or 016 even. That's the most ideal kasi yun yung ginamit sa mga studies eh. But deviating from the protocol, there are allowances for that. There's no need to repeat the series, as long as preferably, of course, you complete all 3 within 12 months. But then again, during an AGIN meeting here in Manila, so lahat pa ng international speakers andito noon, we're also able to talk to Professor Margaret Stanley, so another very world-renowned immunologist. She's actually an immunologist, UK, but based in Australia. She said, well, there's really no need to repeat. The grace period could be as long as 24 months or 2 years. But of course, if that would be the case, we explain to our patients that the immunity that we want, so immune, the full protection might not be, of course, acquired by the vaccinee if we deviate from the regimens or from the protocol. But since we all have immune memory, so yung immune memory, there's really no need to panic, no need to repeat the series.
And I think this also applies when those patients are, what happened during the pandemic, and baka they started their vaccine series and then nag-lockdown.
Yes,
and then they have to continue it again. So that's a very nice question.
Yeah, and it's very valid kasi I think many of us were not able to complete whatever treatment actually. So it's a very relevant question. So thank you to the one who asked that from the audience. Now we have a lot of other questions, but unfortunately we have run out of time. So I'd like to thank again our speakers and Ms. Nines also for their very very engaging Q&A session. So to wrap things up today, we learned about many things. We learned about the burden of disease of HPV. We learned about associated risk factors, manifestations in adolescence, diagnostic and management options in treating HPV. And we also learned the importance of primary prevention through vaccination in adolescence and secondary prevention through screening during adulthood. We also learned about the importance of responsible adolescent behavior. We learned that it's very important and that the support of both the family and the healthcare provider should always be kept in mind. Before we end, we'd like to ask our speakers, Dr. Abalos and Dr. Bravo, may we ask for a few final words, a few points that you want our viewers to remember from this forum. Let's start with Dr. Abalos, please.
Okay, thank you so much, Weng. I think I'll just repeat what I've mentioned earlier, that yes, we can achieve quiescence of HPV by concentrating on the adolescent. So we need to spend time with our patient. We need to spend time with the parents of our patient. From personal experience, if you do explain everything to the parent, then the transfer of information to the adolescent, or even the presence of the adolescents in the group, is almost guaranteed. We need responsible behaviors, and I'm really quite afraid to what the result of the 2021 is going to be, the YAP study. And second, vaccination at this point in time is our greatest fight against HPV. So we need to tell everyone, get vaccinated against HPV at the ideal time, which is the adolescent age group. Thank you.
Thank you, Dr. Jean. Get vaccinated and do so at the correct and ideal time. Now, a few final words, few reminders from you as well, Dr. Bravo.
Thank you, Sis Wen and Ma'am Jean. May kumare, no? Thank you very much for the opportunity. Well, again, as I keep on mentioning,
Kumari ko.
di ma'am, ano lang yan, batang isip, ayan. Kaya po akong idol talaga. So, as I keep on mentioning, adolescents are not exempted from having genital warts and even the precancerous lesions and even cervical cancer and other morbid complications of HPV infection. And as such, again, we need to educate our women, our families in general, kasi pamilya po silang pupunta sa atin, no? So we need to include the children of our patients in giving out advice and offering the vaccine. Ayan. So pag ganito lahat, then potentially we can really achieve silence or quiescence in HPV infection, including among our teenage patients or clients. Including males po, including males yan.
Ako, thank you, Dr. Sybil. Yan, na-emphasize ang multiplier effect ng mga ganitong klaseng webinars. Even if we have our viewers here were the ones who were able to get the information firsthand, you can actually share this information with your friends and family. And finally, some words from Ms. Nines. I enjoyed being in the webinar with you. May we have some final words from you too?
So again, thank you so much for the opportunity to be able to join you guys in this panel. I really like the topic, and I'm sure the other attendees would have more questions to ask you, but unfortunately, we don't have enough time. But this sparks, an action for us to really talk to our healthcare providers, to our parents as well, and to make sure that everything is being laid out. And I also like the inclusion that males are also covered in this topic. I would really want to ask you guys how it is, are males gonna be approaching OB-GYNs in the future for this one, or is there another doctor that they need to approach? But that is, we can take it offline definitely. So again, thank you so much, and we hope to do this again soon.
Thank you, Nines. And that's a very relevant suggestion. And later on, you'll see that we have actually planned for something that can address that. So again, our sincere gratitude to our speakers for giving everyone an informative overview of our topic today. Before we end, we, the Mu webinar team of the Mu Sigma Phi Medical Sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. This event would not also be possible without our co-presenters, In Life Sheroes, the Mu Sigma Phi Foundation, our co-sponsor, Merck Sharp and Dome, and our official media partner, our awesome planet. We are also grateful for the unwavering support of the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. Again, may we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at tinyurl.com/newwebinars 2021 eval within 3 days after the forum. You may find the links to the evaluation form at the comment boxes of FB Live, YouTube, and the chat box of Zoom. And now, Ms. Nines, we would also like to invite you and other participants to be with us again on the next leg of the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on December 28, 2021, Tuesday, from 12 to 1 p.m. for an episode entitled HPV Gone Viral, The Male Connection, or HPV Gone Viral, Ang Ugnayan sa Kalalakihan. This will focus on the burden of disease, risk factors, manifestation, diagnosis, prevention, and treatment of HPV infection and disease among the male population. This is going to be interesting because we'll be spotlighting a different perspective on HPV infection. For that webinar, we will be having Dr. Arturo Castro Jr. and Dr. Arsenio Claro Cabuncal as our speakers. And it will be moderated again by yours truly. For our reactor, we will be having Mr. Anton Diaz, the founder of the top lifestyle blog, Our Awesome Planet. Likewise, please support and participate in our year-long Women's Health Forum series. This is Wen Raymundo. Thank you and have a good day.
Thank you for attending the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation, and co-sponsored by Merck Sharp and Dome.
And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MuWebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MuWebinars and our Twitter timeline at twitter.com/MuWebinars. You may also email us at muwebinars2122@gmail.com.
Before we end, we would like to invite you to the next leg of the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on December 28, 2021, Tuesday, from 12 to 1 p.m., entitled HPV Gone Viral, The Male Connection, or HPV Gone Viral, Ang Ugnayan sa Kalalakihan. which will introduce us on HPV infection and disease among men. The speakers will be Dr. Arturo Castro Jr. and Dr. Arsenio Claro Caboncal, and to be moderated by Dr. Wen Raymundo. We will also be having Mr. Anton Diaz, the founder of Our Awesome Planet, as our reactor.
And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good